Check Podcasts.
Hi, I'm Bruce Williams. I am the CEO of the Greater Victoria Chamber of Commerce. Welcome to Chamber Chats, coming to you as always from right here in the podcasting studios of the Czech Media Group, one of our chamber champions. I would like to acknowledge the Lekwungen-speaking people, known to us as the Songhees and the Esquimalt. It's my privilege and honor to live and work alongside them in their territories and their land. Chamber Chats is made possible by the support of Island Savings, a division of First West Credit Union, who have a team of professionals with solutions as unique as your business. We here talk about healthcare every single day in the news, in conversations that we have with family and friends. And there are lots of people that are complaining about the nature of our healthcare. But you know what? In comparison to so many other parts of the world, we are world class, first class. And part of that is due to the work of the organization that my guest represents today. Avery Brohman is the Chief Executive Officer of the Victoria Hospitals Foundation. Avery, how are you?
I'm good. How are you doing?
Good, thank you. So you're an organization that makes excellent healthcare possible by enhancing the medical system itself. So let's talk about why the foundation and your work is so important.
Thanks. I always like to start off by highlighting that the strongest hospitals across Canada have the strongest philanthropy around them. And I know in simplified terms, healthcare is free, but basic healthcare is free. If we want advanced care, we need to donate for that. And we're not alone. Every single hospital across Canada has a foundation, and many foundations have very proud supporters around them like ours. And those supporters help catalyze the latest in care and bring the best tools and technology to the hospital setting. If we were to wait on government and government alone, simply put, we'd be waiting for a little bit, a while actually. So we steward gifts from so many people that really truly understand that if we want advanced hospitals, we want excellent care, at times we need to donate, towards that. So yeah.
That's what, I mean, it's, another way to put it, you mentioned government. If government had to do everything that your foundation does, it would cost us more tax dollars. And as you say, it would probably take longer. And it's a little more expedient to do it the way that you guys do it as well. So
absolutely.
So we talk about the work you've done in the past. Some of the foundation efforts in the past have created some equipment and some things that we all know about. So let's talk about a few of the past campaigns, and then we're going to talk about the current one. But tell me about the last couple.
Well, thank you. Yeah, our donors are remarkable. They fund 40% of the equipment at Royal Jubilee and Victoria General Hospitals. And I can't imagine what our hospitals would look like without that equipment that they've supported. And they support it in many different ways. We work with Island Health, talk about their priority needs with them, and identify those needs before we go out to campaign. So a few of the campaigns that we've done in the past that I'm really proud about. Last year, we did an Emerge Stronger campaign. That's what we called it. And it was just really helping our hospitals emerge after that pandemic and the aftermath of the pandemic. And it was long, as you know. It funded 200 pieces of brand new equipment for both hospital sites. It was touching every single area of care. And truly, everyone that needs our hospitals in some ways will touch those 200 pieces of equipment. So that was really exciting for us. We focused on recovery from the pandemic, local care, which is bringing new equipment pieces into the health authority and into our hospitals that we didn't have before, and innovative pieces of equipment that truly would only be made possible because of philanthropy and donor funds. Prior to that, we did a mental health campaign. It was called Equip to Heal. We were supporting a brand new unit in the Eric Martin Pavilion here, right across from Royal Jubilee Hospital. And we were trying to expand space. We know there's incredible demand, especially as it relates to substance use and mental health in our community. And then COVID, that was a really hard time for us. I mean, there's still, COVID in our community, and our hospitals are still struggling because of the pandemic, but not in a way that we were in 2020. I remember that day clearly. It was March 17 of 2020. I came to work to close the office because we were all going hybrid, and every single car in our parking lot every stall was used. So it just goes to show you that the hospitals weren't closing, but every other business was closing. And within that time, we funded a brand new unit, a high acuity unit, actually for both hospitals at Royal Jubilee and Victoria General. And we funded all of the equipment, all of the space that would essentially expand critical care by 73% here. So Bruce, that was really made possible by our donors and our community responding to the time that we're in and the greatest needs of our hospitals at that time.
Because, the healthcare providers, the doctors, the nurses, the researchers, all the rest of it, when they know that technology exists that can help us heal and keep us healthier, you want to get your hands on that as soon as you can, right? And that's what your dollars do.
Absolutely. And we love prudently stewarding those dollars and we show the impact with our donors every single chance we get. And we celebrate too. Having the best and brightest tools in our hospital system and our health authority actually attract and retain the best and brightest caregivers as well. So when you have really innovative equipment pieces, or you have equipment that, doctors are able to use here in Victoria versus needing to go to a larger site like Vancouver, Montreal, Toronto, we're really able to elevate care here. And that feels really good.
Yeah, because that's if you're not feeling well, if you're sick, if you're seriously ill, the last thing you want to do is travel. So
No.
having that up-to-date stuff here is very important. And I want to come back to the idea of tax dollars once again. Um, we could be paying higher taxes to pay for a lot of this stuff, but instead, you're giving people an opportunity to get a tax receipt for the money that's invested in you, right? Tell me about that.
Yeah, every single donation that you make with our foundation, you're eligible for a tax receipt. And so many of our donors are very sophisticated and strategic with their tax dollars too. For example, they're not just giving cash, gifts of stocks and shares that may have capital gains on them. They can donate those to us and then get a tax receipt for that. It really is it's beneficial to be donating as well. You won't get 100% of that, dollar back, but you're certainly going to make incredible impact along the way and support yourself at the end of the year for tax season.
Yeah, it's an investment. I always call it an investment because the return on the investment is better and enhanced healthcare. That's what goes on.
Yeah.
So there's a current campaign. You're going to buy some really cool stuff. I want to talk about that next. Our guest on Chamber Chats today is Avery Brohman, who is the CEO, the Chief Executive Officer of the Victoria Hospitals Foundation. So there's a campaign underway now, Avery. What's this campaign for?
Oh, this is a magnificent campaign. We're calling it Imaging is Power because there are so many powerful imaging tools in our hospitals that need an upgrade. So this is an $11 million fundraising campaign that aims to upgrade 6 powerful imaging tools, 3 MRIs, 1 CT scanner, 1 SPECT CT scanner, and a C-arm for our heart health lab. If you can imagine the workhorses of our hospitals and the equipment that gets used the most, it's imaging equipment. So being able to advance this equipment, some replace, some refurbish like new, it will allow a quicker imaging time. I'm sure like Bruce, my ear is on the community too. I feel like I have a good pulse of what's happening in the community, and we're hearing a lot about wait times. This campaign will respond to those wait times, and we will get advanced imaging equipment because of that. So in terms of our campaign, we hope that we can complete it within a year. We never know, but what we're doing is we're being very strategic about what comes first. So we don't want to be replacing all of these pieces of equipment at the same time. We want to be strategic. So there's, care is not down at any given time. So we're starting first with the MRIs. And what we're doing is we're refurbishing our MRIs instead of replacing them entirely. And by doing this, we can do it at 1/3 of the cost. We're actually going to be the very first hospital in Canada to do this innovative new technology transformation. And that feels really good. Our radiologist came to us at the Hospital Foundation and said, there's a lot of hospitals doing this in the United States and Europe. Can we do this too? We said, absolutely. If it's safe and there's no risk, absolutely. So we've been able to do that. And for, 3 for the price of 1, it doesn't really get better than that. And that makes me feel really great because we're also being very responsible about what we're asking our communities to support. We know giving is tough right now. We know times are trying. We're all still recovering from the last few years. So by enabling new MRIs into our hospital for a fraction of what they would cost before, that feels very good.
Yeah. What's the time frame on the campaign?
We always say it's up to the community,
Right.
truly, but I would love to be able to do this in a year's time
Mm.
because we have so many other needs that we have to start initiating fundraising campaigns for, Bruce. So if we can do this within a year, that's great. It is $11 million. We're asking our community to respond in a very great way, but we also know that every single day, 500 people use scans in our hospitals. So it's great impact. And we're hoping that many people that may have used a scan in the past or need one in the future will respond and donate to this campaign because it's meaningful for them.
So $11 million is a lot of money. And I just want to put it out there that don't rely on someone else to come up with the money. All of us have a responsibility to be a part of this. So please do what you can to support this campaign. So when we take a look at where the money is going to go, where the dollars are going to go, and various campaigns come along, um, how are the campaigns prioritized, or how is the acquisition of equipment prioritized?
Thank you. It's prioritized by our care teams. They share with their department leads what they need at any given time. It's not up to me or our foundation to determine what the highest priority needs in a hospital setting are because we're not the caregivers. We're not delivering the care. We're supporting the care truly, but we have professionals for that. So there is a quite a rigorous process that we initiate with Island Health to make sure that we are fundraising for the highest priority needs. And the caregivers are those messengers. They're the ones that are saying exactly what they need. There's an approval process, and then it comes to us as a foundation. And we like to market that into a campaign to really show what this will do for the community, but also share very meaningful stories. We get to learn from patients who've needed these, equipment pieces before, or units that will be supported if we don't have something currently in place. We'll talk to the care teams themselves and share those stories. Very heartfelt, very authentic. So it's quite a process, but really it's determined by Island Health and the caregivers who work inside the health authority.
Yeah, we all live in the expectation that we're never going to need critical care of any kind until something happens, and then we do, or if it happens to a
Yeah.
loved one or a friend or a coworker or something like that. But you do some things that fall within specific care areas. For example, women's health. You do things that focus directly on women's health. Tell me about that.
So we have 11 areas of care at the hospital that we support directly. Women's health would a lot of that is gynecological care. There's some maternity care as well, and that would be the departments themselves reaching out to us saying, "These are our priorities for the year. These are, what's made the list. Can you help us out?" What you see, Bruce, in the community is only one thing. You're seeing a campaign. But in the back end, and the reason I have such an incredible dynamic team and many of us work at the foundation is we're able to steward donations from individuals that care deeply about a certain area of care. So if it's women's health, someone can call the foundation and say, "What are the highest priority needs in women's health?" And then we can initiate and steward those gifts. There is no area of care in our hospital that does not have great demands and great needs. So there's so much more than just what we're projecting and sharing in the community as it relates to a campaign.
There's kind of general, you talk about cancer and you talk about cardiac and critical care and all of those things too. They are, again, embedded in this priority area, right? So there's specific equipment for all of those things, correct?
Yes, yes. So some of the areas of care that we focus predominantly on are critical care. We have cancer care as well, emergency care, maternity care, and those are just a few. But those areas of care are always pretty heavy as it relates to the needs because they're in demand. We need those core areas of care, especially our two sites. And when I talk about our two sites, which are Royal Jubilee and Victoria General Hospital, and that 40% of equipment that is initiated by donor funds, they're also the referral sites for the island. So, those areas of care that I just mentioned, we don't have those areas of care at other hospitals on the island or all of the hospitals on the island. And 50% or more of the patients that are accessing care at our two sites daily aren't necessarily coming from Victoria. 50% are outside of the Greater Victoria area. So we have very strong hospitals, very busy hospitals. Over 100,000 people use both hospitals every single year, and it's so important that we keep them strong and we equip them with the priorities that our caregivers are identifying, that essentially government can't do, or it would take a little while for them to do it.
So there's this big focus on physical health, the things that impact our bodies. But you referred earlier on to something I want to loop back on. Coming up next, I want to talk more about what you're doing in the area of treatment of mental illness and mental health. Our guest today on Chamber Chats is Avery Brohman. She is the CEO of the Victoria Hospitals Foundation. So, Avery, you mentioned earlier that you've done some things around mental illness, mental health, depending on how you frame it and how you look at it. But tell me how the foundation supports that.
Yeah. So several years ago, we initiated our very first mental health campaign, Bruce, and it was called Equip to Heal. We know that we are healing minds as well as physical bodies at the hospital. And what we did is we built a unit that would have 19 new beds and increase capacity for mental health and substance use patients in a very urgent way. We were able to do this campaign in 4 months. We had over 400 people in the community step up and help us raise $1 million for this. And what it did was expanded beds and capacity in our mental health facility at Eric Martin Pavilion right beside me here by 35%. And that's a huge impact that our donors had. We know that in the future, there's some more mental health needs. Once we can wrap up this campaign for the imaging, we're going to be focused on a child youth mental health campaign unit at Victoria General Hospital. It has been identified over the last few years as a very critical unit that is needed. Currently, right now, we only have 4 beds for children that need mental health services. We know that that's not appropriate, especially for the demand that we're seeing. So we want to build a purpose-built unit. That takes time, that takes professionals. We're engaging those professionals right now, and we want to be really responsible with how much we're spending to do this. So more on that in the future, but we are really focused on mental health as well as physical health.
There's not a single day when something to do with mental health or mental illness doesn't enter into conversations for all of us, I'm sure. I mean, at the Chamber, we hear about housing costs and the cost of living and workers and public safety, but mental health is embedded right in the middle of that, and the manifestation of mental illness is something we need to do that. And it's so important for kids, right?
It is so important. And we have to understand too, a mental health patient, the way that they need care is very different from physical health. Imagine we had a heart attack and we're recovering in a bed, not moving. That's not really the place for a mental health patient either. So when I mentioned we're doing a purpose-built facility and unit for our children with mental health issues, we wanted to do that in a very therapeutic way as well. So the setting and having a very therapeutic and welcoming and warming setting, that's very critically important. And we currently don't have a unit in the hospital that embodies that. So it's going to take some time, but we're going to do it very well.
Making an investment in what you guys do is one way to help out, but we can all recall back early days and middle days of the pandemic. At 7:00 every night, people would go out on their porch and they would bang pots and pans to say thank you to healthcare workers. Heart-shaped signs popped up all over the place. Thank you to our healthcare workers and healthcare givers. Mm-hmm. What else can we do, whether it's through your foundation or otherwise, to help support those healthcare workers now?
It's as simple as a thank you, Bruce. If you are experiencing care at one of our hospitals, make sure that you thank a caregiver. We have a really great program at the foundation that's called Caring Spirit Program. So someone can give an honor or tribute to a caregiver and the care that they received. And we award them with a special award. We give them a pin for their lanyard and they're recognized. And truly, it's a fulfilling way for them to feel like the community is responding to them just outside of the equipment and traditional needs that we do fund. Caregiver recognition has been a significant pillar of our work over the last few years. COVID really made us focus on the people inside our hospitals, the stories that they have. Everyone is a person, and we've been initiating a really great storytelling campaign called Humans First. If anyone wanted to check it out on our website or social media, it's called #Humans First. And we really went inside the hospitals to talk about who it is, these wonderful hospital heroes that we were calling them hospital heroes. They still are. Who are these people inside the hospitals delivering care? What do we need to know about them? And that has been really rewarding for our caregivers, just to be recognized and seen. But we've also understood, the how important a warm cup of coffee or a warm muffin is. Over the holidays, we're delivering hampers now, and we're letting people know that the community is seeing them in a very great way, and it's more than just the tools that they need. It's how do we recognize and how do we retain these amazing people that work in our hospitals, and they're devoted to us 24/7. So if people do want to give back in those ways too, giving a donation in the greatest need. So visiting our website, coming into our office, giving us a phone call, and highlighting the greatest needs. We do draw from our greatest need funding to support employee recognition. And we know that, so much of our work is it's more than building the care in our hospitals. It's building morale and supporting staff too.
I was very pleased to be asked to be a part of a video shoot that we did not too long
Yeah.
ago at the hospital. Tell me about that and where that video can be seen. We show it a little bit right now, but tell me about the video.
Yeah, so the video it's symbolizes our latest campaign. It's on our website for Imaging is Power. And we take our donors and our community members inside the units and show them what philanthropy can do. And at the very end of the video, there's this beautiful still photo of so many community leaders in our community and our donors and staff members and hospital staff that are just standing tall and proud, the way we should be for our hospitals every single day. And it was a really special moment. And thank you so much for participating. You've been such a champion of ours, and you've allowed us to share our campaigns and have a voice. And I think that's so important. Our community needs to know what our hospitals are feeling, how they're doing. We need to know what the greatest needs of our hospitals are. In many ways, we're a charity, but the hospitals are something that everyone should be supporting, and then support your favorite charity. It's up to all of us to make our hospitals strong. And we're really trying to create that culture of philanthropy on the island. And Bruce, you help us do that. So thank you.
It's our privilege and honor to do that. So let this podcast be an inspiration for you to go online to the website and make an investment in what happens at the Victoria Hospitals Foundation. Remind us of the website again, Avery.
victoriahf.ca.
Go there and do that now. Don't wait for somebody else to do it. Avery Brohman has been our guest, Chief Executive Officer of the Victoria Hospitals Foundation. Avery, thanks to you and your whole team for all that you do all the time.
Thank you so much, Bruce.
I'm Bruce Williams. We'll see you again for another Chamber Chat.